exercise during pregnancy? My doctor has advised me to exercise for at least 30 to 60 minutes every day or at least 5 times a week. Whereas my family and my friends are scaring me, telling me that exercising during pregnancy can be very risky for me and my baby. So what should I do? This is a common question that a lot of pregnant mothers have during the pregnancy period. So in this video, let me break down all the myths that are related to exercising. I will be taking you through, is exercise safe during pregnancy? We will discuss the benefits of exercising during pregnancy for you as well as for your baby. We will also tell you about the type of exercises that you can do and some tips to note before you start exercising during pregnancy. Hi, I am Saranya, the founder of Babypedia and a birth professional. I have an experience of more than 5 years and I've helped more than 2,500 couples navigate pregnancy, birth and postpartum with confidence. So now, is exercise safe during pregnancy? Well, the answer is a big yes if it is a low-risk pregnancy. Always, before you can start any form of exercise, as simple as walking, you will have to get the go-ahead or the okay from your doctor. So that is very important. Always discuss with your doctor if you can start and then start exercising. You have to ensure, so what is a low risk pregnancy? You will have to ensure that you do not have any complications like severe anemia, placenta previa, incompetent cervix, ruptured membranes, or a history of previous preterm births, miscarriages, etc. In case you have any pain or discomfort in your vagina or in your body, any dizziness, spotting or bleeding, cramping, any leaking of fluid from your vagina, muscle cramps, etc., please refrain from exercising. Talk to your doctor and then you can continue after your doctor says or gives you the go ahead. Do not play any contact sports, very important, and avoid jerky, jumpy movements because during pregnancy, your ligaments are very relaxed due to the secretion of the hormone relaxin, and your center of balance is also not right. It is changing as your stomach grows bigger and bigger. So you have a higher chances of losing your balance and falling. So that is why we advise do not go for any contact sports or any jerky jumpy movements where there is a higher chance of you losing your balance and hurting not only yourself but your baby as well. Now, what are the benefits for you when you exercise during pregnancy? Well, you will experience more blood circulation and better cardiovascular health. So that means better absorption of nutrients for you. Again, there is a reduction in the discomforts that you are facing during pregnancy. See, discomforts are a part and parcel of pregnancy, but one way to manage and reduce these discomforts is by exercising. Some of the discomforts that you will get relief from when you exercise are backache, swelling of your feet, improper posture, etc. Exercising will also help you manage your mood swings and it will reduce your stress levels, thereby it reducing your chances of getting depression, anxiety, and other mental health problems that are very common during pregnancy and postpartum. Exercising also has a good side effect, that is you will be able to sleep much better, and good sleep is very, very important not only for you but the health of your baby as well during pregnancy. You will have better stamina to manage labor and birth, and we know that there is women who exercise during pregnancy are able to recover faster after birth. You will also be able to balance your weight gain during pregnancy. And we know that women who experienced during pregnancy actually felt lesser pain and they had shorter labor and birth timing. They were able to deliver their babies faster. Okay, that's a great advantage, right? It also reduces the chances of pregnancy complications like gestational diabetes, hypertension, preeclampsia, etc. And you will also get a lot of relief from constipation, which is very common during pregnancy for a lot of women. Now let's talk about the benefits for your baby. Now, when you have a higher heart rate when you exercise, your baby's heart rate will also increase. So there is a better circulation of blood for your baby and your baby gets a better supply of nutrients and oxygen as well. This will definitely help your baby to grow better and more healthy. The placenta is formed very well and is more healthy when mothers exercise, especially during the first trimester. So when the placenta is healthy, it leads to better improvement and better exchange of nutrients and waste matter between your body and your baby. If you exercise during the first trimester, there is better placental functioning throughout your pregnancy, not just in the first trimester. There is also lesser chances of complications like preterm labor, low birth weight, or IUGR, that is intrauterine growth retardation, which means your baby stops or there is a high reduction in the growth rate of your baby inside the uterus. You will also be able to tolerate stress much better, not only during pregnancy, but in life and especially during labor and birth. When your baby can handle labor with less stress, then there is a lesser chances that your baby will pass meconium during labor, and there is a lesser chance that there is a fluctuating heart rate. These are two very common reasons to rush for an emergency cesarean. So this can be prevented when you exercise during pregnancy, right? Also, babies whose mothers exercise during pregnancy are able to regulate their body temperature much better after birth, and they lose lesser weight after birth. So that is a big added advantage, right? So now coming to what are the types of exercises that you can do during pregnancy. Low impact exercises are recommended, especially if you are a beginner and you have not exercised much before you became pregnant. So some examples of low impact exercises would be walking, yoga, swimming, Pilates, etc. Moderate impact is okay if you have already been exercising before you became pregnant. So these would be aerobics, dance workouts are some examples of moderate impact exercises. Now let's talk about some tips that you can follow when you are exercising during pregnancy. So the first one would be start slow, especially if you are new to exercising or you have taken a break, let's say in the first trimester, when you have been exercising. Then start slow. It is okay to start even as minimal as 15 minutes and slowly build it up to 60 minutes as your stamina and your strength increases. Remember that consistency is more important than just doing a 60-minute workout in the beginning itself and then not being able to move your body and taking rest or a break for a week. So start with 15 minutes and slowly work on, and as you are able to do more, just start increasing it by 5 minutes every day or 5 minutes every week and slowly build it up to 60 minutes. The second thing is maintain your heart rate at 70% of what you would normally do. So one best way to test this is by what we call as the walk and talk test. You should be able to talk comfortably, though a little breathlessly when you are exercising, but you should not be able to sing. So that is the maximum level that we would recommend to work out during pregnancy. The third is always work out under a trained professional who knows how to help pregnant mothers. There are a lot of precautions and variations that you will have to follow when you are exercising during pregnancy. So somebody who is certified or trained to teach pregnant women would be the best type of instructor who you can join and who you can refer to when you are exercising. Also stay cool through your workout. So avoid steam, avoid any hot rooms or hot tubs during pregnancy, and do not work out outside if the weather is too hot. Try to open all the windows and exercise in a very airy room, or you could also exercise in an air-conditioned room if the weather is very hot. Okay, remember warm-ups and cool down is compulsory, especially during pregnancy. This will help prepare your muscles for the workout, and cool down will help to stretch all the muscles that have become very tight during your workout. Starting abruptly without a warm-up can lead to blood pooling or clotting in your muscles that can lead to a severe cramps and complications as well. So always remember, you can just warm up and cool down for as minimal as 5 minutes before and after your workout, and it is compulsory. You can cool down with a few minutes of breathing and stretching and just a little bit of savasana as well. The sixth would be, along with other forms of exercise like yoga, swimming, Pilates, etc., try to walk at least for a minimum of 30 minutes every day, because walking during pregnancy has its own set of benefits like preparing your pelvis and your pelvic muscles for birth. So try to always walk. You can walk 10 minutes after every meal, or just increase your step count as much as you can throughout the day. The seventh would be, please pay attention to your body and listen to your body. Never exercise when you feel any sort of discomfort or when you're feeling overly tired or dizzy. Stop exercising, and you can do it on another day. The eighth is, after the 4th month, do not lie down on your back for prolonged periods of time, or do not do exercises that require to stand for a long period of time, because this can lead to a lot of discomfort and complications. Lying on your back could hinder blood flow through the vena cava, that is a major blood vessel that carries blood from your lower body to your heart. And standing for long periods of time could lead to varicose veins. So try to avoid all this at all costs. Sit-ups, leg lifts, back bends, etc. should definitely be avoided when you're exercising during pregnancy. The ninth most important point is keep yourself hydrated throughout. Keep sipping on water throughout the period. Don't gulp water, because that can leave you feeling very nauseous when you're exercising. But just take a couple of sips in between every 10 minutes or so during the period of exercising. And eat healthy, light snacks at least 20 minutes before your workout. This will ensure that you do not suddenly get low blood sugar levels and feel dizzy during the exercise time. Wear proper workout clothes. Okay, do not work out in very tight clothes. It has to be very airy, breathy, and your clothes should be able to absorb the sweat, and it should be able to stretch and accommodate all the exercises that you are doing. You also may need to wear good sneakers if you are going to do low or moderate impact exercises. Again, during pregnancy, many will tend to concentrate on strengthening and opening only the lower part of your body. But remember, you will need to strengthen the upper part of your body as well, because after your baby is born, you will be carrying your baby to breastfeed and to take care of your baby. So you will need to strengthen your shoulders, your hands, and your upper back as well. And start doing it during pregnancy itself. Be consistent in your workouts. Remember, small periods of workout for 3 to 5 days a week is much more beneficial than just doing one long stretch of 60 minutes once a week. So being consistent is very, very important when you are starting to work out. Choose a form of exercise that you like so that you will be able to be consistent and stick to it. You could also plan multiple types of workouts into your week. Like one day you could go for dancing, one day you could do prenatal yoga, another day could be just for stretching all your tight muscles, etc. So this variety will keep you more interested so that you can consistently work out throughout your pregnancy and also continue it postpartum as well. Don't forget your stretches. Like I already told you, stretching is very beneficial during pregnancy. So try to incorporate at least 10 minutes of stretching 3 to 4 days a week. Okay, exercising and working out is more of a mind game than a body game. You need to be prepared mentally to start exercising during pregnancy. Sometimes you may feel like you have some fears or some mind blocks that are holding you back from exercising. You know, like somebody else has had a miscarriage, or they've had a complicated pregnancy. So you're very scared and you feel like you may also experience the same if you exercise. So if you have such fears or mind blocks, talk to your doctor. They will be able to clear it for you. You could also, start accepting your fears, relaxing before you start working out. This will help you, improve the quality and stay consistent when you are working out. Okay, breath work is as important as exercising. So always try to do a little bit of deep breathing before or after you exercise, or at least anytime during the day, like as soon as you wake up or just before you go to bed. Breathing will ensure that you get a lot of oxygen and also help reduce your stress levels and prepare your body for pregnancy and for birth as well. Okay, so some recommended exercises that you can do is, please add a few calf stretches to your routine, because your calves are directly connected to your pelvic floor and your lower back. And when you stretch your calves, you are loosening up and stretching the muscles in your pelvis and your lower back as well. Incorporate squats into your routine. It can be your normal squats, sumo squats. It can be the Indian toilet, that is your full squats as well. Whatever works for you. If you can do all three or even more variations of squats, it is most welcome during pregnancy. Pelvic tilts, hip bridges, the cat and cow, butterfly pose, bicep curls to strengthen your upper body, and breathing. That is, you could try incorporating diaphragmatic breathing or 360-degree breathing or belly breathing. These are all different names for the same type of breathing that is very good to strengthen your core muscles and to work on your diaphragm as well. So these are some of the exercises that you can incorporate into daily in your routine during pregnancy, because they have a lot of benefits for you during pregnancy and after birth as well. So if you found this video useful and you got a lot of information from this video, please do like the video, comment your thoughts on what you learned in this video, and if there are any other topics that you would like me to talk about with regards to trying to get pregnant, pregnancy, birth, and taking care of your newborn baby, do let me know in the comments below, and I will definitely make videos on those topics as well. So don't forget to subscribe, because only then you will get notifications when we publish new videos and you can benefit from all the videos. Take care. Lots and lots of love and strength to you. Have a happy, healthy pregnancy. This is Saranya signing off.